Hey, it's Dr. V, your favorite psych NP. So if you have ADHD or think you have ADHD and you're hesitant about taking medications, then this video is for you. I want to start out by emphasizing the importance of getting a clinical diagnosis from someone in the psychiatry field, so either a psychiatrist or a psychiatric nurse practitioner. We have specialized training in order to be able to help you find the right diagnosis and also find individualized care. All right, so at the core, ADHD is a dopamine dysfunction. So there's three different types of ADHD: inattentive, hyperactive, and combined. So the relationship between ADHD and dopamine is complex, but there's a lot of research that shows that lower levels of dopamine have been found in people with ADHD. Dopamine is a chemical that plays an important role in motivation, reward, movement. It can also affect attention, focus, and your overall mood. So probably the number one question that I get is, when should I start treatment, especially for kids or for younger adults? So the real answer to that is going to be specific to you and your needs and what's going on. But basically, if you're struggling in school, at work, and at home, forgetting things, bumping into things, having accidents, walking into a room, forgetting why you went in there, finishing other people's sentences before they're done, interrupting when other people speak, fidgeting, squirming, not being able to stay in your seat for a long time. So again, it's going to be very patient specific, but if you're having all that criteria and it's causing distress in your life, then medications might be appropriate for you. Also, you want to consider that you've done everything that you can on your end that's non-medicine, non-pharmacological, like setting alarms, organizing the room where you're going to be at work, at home, to keep everything labeled and clean and organized. That kind of helps. Also, taking supplements like omega-3 fish oils, that has been shown to assist. Also, taking supplements like L-theanine has also shown to assist. So if you've already done all that and the symptoms are still reoccurring or the same, then that's when you want to consider medication. Now, there's two different types of medications. There's stimulants and non-stimulants. I'll start with non-stimulants. That's going to be medications that you have to take daily, and they're going to help with multiple things: anxiety, depression, and ADHD symptoms. So again, these medications you have to take daily, and they're going to help with multiple things. They're not as effective as stimulants when we're talking about specifically dopamine. So stimulants now are going to be first-line medications for ADHD. That means it's one of the first things that's approved to give to you, and these are going to work immediately. Within the first hour of you taking the medication, you're going to feel a difference. With non-stimulants, you're going to have to take it daily for the levels to get to a therapeutic level in your body. Now, who shouldn't take stimulants? These are people that have a history of abuse of alcohol, abuse of substances, or also people that have underlying medical issues, specifically seizures or cardiac issues. A stimulant wouldn't be recommended, and you could use one of the non-stimulant medications. Examples of non-stimulant medications for ADHD are going to be Wellbutrin, Cymbalta, Effexor. There's also another level of non-stimulant medications, and these are typically started for kids, and they're called clonidine and guaifenesin. Now, these are going to help more with kids in the hyperactive realm. This is, again, why it's so important to get a correct diagnosis from someone in psychiatry. That way they can rule out all these other comorbidities that can, potentially lead you to start the wrong treatment and have negative side effects that might not work for you. So here we go. Let's talk about the side effects. The first one, with stimulants, the main side effect is going to be decreased appetite, which is going to cause some weight loss. Now, in children, it is talked about. It is a controversial topic for a decreased growth rate for children. But I always tell my patients that if you already know this medication is going to take away your appetite, then you need to know that you need to follow a scheduled diet plan, and you're going to incorporate healthy meals. So if you have children and they're taking stimulant medication and you're not feeding them appropriately, they're not going to tell you they're hungry all the time. So that is something that can be an issue. But if you stick to a well-balanced diet, 3 meals a day, then that could potentially, resolve that issue. So that's the main side effect, is decreased appetite. The next one that could be an issue is decreased sleep. It's going to be a stimulant. It's going to increase energy, focus, motivation. So if the dose is too high, then initially what will happen is that patients will have trouble sleeping. So the best recommendation is to take it with food in the morning. That way you kill, 2 birds with 1 stone. You're able to eat and have a big breakfast, and then you're also able to kind of mitigate the side effect of sleep. Now, the third side effect is going to be more specific to each patient. So if you have a cardiac history, this is why it's not good for you. But it's going to increase your heart rate, increase your blood pressure. So if you have any abnormalities with your heart, you definitely don't want to overwork your heart with the stimulant. However, I have had patients that have high blood pressure and it's controlled and they take medication and they're also on a stimulant and they do well. Another major negative side effect of a stimulant is that it can increase your mood and put you into mania or euphoria. This is definitely not something that we want to induce, where you can make terrible decisions, such as gamble or have multiple sex partners, etc. So that also leads me to the next side effect, that there's a high abuse potential, meaning that you can become dose dependent. You can kind of find excuses to take it every day, even when you don't have a need for high concentration, like on your day off of work, or you're just at home, not, just want to play video games. And that also leads to patients taking more than the allotted amount or prescribed amount. This is why stimulants can only be prescribed at a 30-day supply. So you can't get refills or refill early. You got to wait till those 30 days are over for that reason. Now, people always talk about the negative side effects, so I want to talk about the good side effects, because you're going to see positive changes immediately, especially if you start a stimulant. If you start a non-stimulant, those changes are going to take a little bit longer, but you should see changes within the first 2 to 3 weeks. But some of those good benefits that you're going to see are less dopamine seeking behaviors, like less doom scrolling in the evening, less evening snacking. And think about it, whenever our dopamine levels are kind of low, then we're like, oh, we're just going to get a little coffee or get a chocolate. And those consistent habits, lead to, negative coping skills. Another positive side effect is that it works immediately. It's kind of described as putting on glasses. So you're going to know that the medication is working within the first hour, and you're going to feel a difference. A lot of people just describe it as an aha moment, or a period where they just feel so much mental clarity and less anxiety. So those are some of the things that are good about stimulants, is that they work right away. Also, another great thing is that there's various combinations. There's short acting, long acting. Some patients take a long acting in the morning, and then at 2:00 they take a short acting. So it's very specific to your lifestyle and your specific needs. That's why, for the third time, it's critical that you see someone in psychiatry that practices this. Now, here's the big one for me. Let's say you're like, all right, I'm not going to take medication. I don't want to do it. What are the negative consequences? So for children, it's academically. Academically, they might get left behind in school. They might fail a grade. They might have trouble with hygiene, especially at a younger age. And it's going to really develop a lot of negative self-esteem if it's untreated. Also, one of the major scary things for parents is car accidents. There's an increased risk of children with ADHD that are unmedicated to have car accidents. So that's also a scary thing when talking about children and just the nature of impulsivity and having accidents. As far as for adults, it's going to cause overwhelming anxiety if it's untreated, and it can lead to two things. Number one, substance use, where you're going to be self-medicating in order to mitigate and treat your symptoms. And the second one is it can lead to depression, because you're constantly having the guilt, constantly comparing yourself to other people that have, quote unquote, have had life so much easier because they don't have an impairment to learning and attention and focus. So it really turns into depression and anxiety as an adult if it's untreated. Anyways, I hope you learned something today, and I hope you found this information meaningful and you can share it with someone that maybe has been on the fence about treatment. And lastly, if you're looking for individualized care and live in Arizona, click the link in my bio where I have weekly appointments available. And I'm also now excited about offering Wednesdays in person. So if you live in Arizona and don't want to do online and want to see me in person, I now offer Wednesdays in person at my location. Thanks again for watching, and I'll see you on the next one.